Hello, I'm Yvonne Rydin from the Bartlett School of Planning, and today I'm delighted to be talking with James Pack from Sentinel RPI about Fitwel. Welcome, James, to this recording, and many thanks indeed for talking to our UCL students. Perhaps you'd just like to start by explaining what Sentinel RPI does as a company.
So Sentinel RPI we are a sustainability and health and wellbeing consultancy. So we work with our businesses, with our clients, which are typically businesses, and we help align their buildings, the people that work in them, and the roles that they perform through the lens of environmental and social responsibility. And from that perspective, we're looking to improve sustainability, recruitment, retention, and ultimately productivity.
And one of the key things you do is applying the Fitwel standard.
Yes, that's right. In terms of health and well-being, yes, that and others, but yes, absolutely.
So perhaps we could talk about Fitwel, and perhaps you could outline a little bit for us how this standard works.
Yeah, sure. And what I'll do, if that's okay, Yvonne, is I'm just going to share a screen, so that we've got a bit more. So I've got a bit more information to demonstrate and to show you, and this will go through this in a couple of just in a couple of slides, and I'm just going to make this into full screen mode so that everyone can see it. So Fitwel is a high impact built environment certification which is designed to support healthy workplace and environments to improve occupant health and productivity. I should add that there are additional certification standards out there that cover specifically health and well-being, and perhaps the better known for many, certainly and amongst the larger real estate and corporate real estate occupiers, is something called the Wellbeing standard. And Fitwel was a slightly later organisation or standard to the game. However, it has been establishing far more traction over the last 3 to 4 years with the global real estate and property community. And it should also say it's not fundamentally about real estate or property. It's about organisations and occupations. And many of the strategies that are promoted in it are relevant and specific to almost facilities management or occupational management sort of management strategies. One of the principal reasons why it gained traction and has gained traction over the Wellbeing standard, for example, over the last couple of years, fundamentally is probably about cost. There was a significant cost differential when it came to certification fees. However, that said, the Wellbeing standard has been reducing those. However, it also offered a slightly more unique or different approach to how the other certification systems work, and the approach allows for applications on strategies that are based across both economic and evidence-based scenarios. The first thing to understand that within the Fitwel I'm not sure necessarily whether all the students are familiar with other certification standards, but often these certification standards, such as the BREEAM or the LEED in the US or the SCAR rating in the UK, often have a number of mandatory requirements, or what are often called in the US prerequisites. So Fitwel doesn't have any prerequisites. So there's no one single strategy that you need to achieve in order to guarantee you achieving a Fitwel score, and that was quite it was quite significant, and I'll explain shortly the reasons behind that. Secondly, all the Fitwel strategies are applicable and impactful to existing buildings, and so they're fundamentally looking at existing building stock or existing spaces or existing workplaces and some of the scenarios and things that could be brought into play there. So there is theoretically no new project intervention that's required, which is often a stumbling block. I think people often look at any opportunity, if they're going to do a new project, will first of all decide, well, we're going to do a project in a couple of years, so we'll do it then. So from Fitwel's point of view, you can jump in at any stage, within a workplace cycle. And finally, the certification and verification process was far less onerous. It's more user-friendly, so that it could be completed through a user-friendly sort of web-based platform that allows you to submit information and evidence, which will then go off to a third party verifier from that point of view. So in terms of what it covers, it's quite broad now, but fundamentally, we're looking at the workplace in terms of office workplace, whether it be multi-tenant based buildings, multi-tenant buildings or single tenants, or just commercial interior spaces. It covers retail spaces, residential in terms of multifamily, incorporating multifamily residential. And also, perhaps more relevant right now, is it also covers viral response. And the viral response module, which has been designed and set up or adapted specifically to suit the current pandemic. It is something that is being launched and put out right now. And this might be, Yvonne, just going into viral response, it is something that we could perhaps discuss at another date. I'm not sure we've got time to go into that right now. The way that Fitwel is scored is based on a rating or a star rating system, and this is where the fact that there are no prerequisites, no single strategies that you need to achieve to guarantee your score comes into effect. Each of the 63 strategies that there are have a weighting, a number of points allocated to them. So those that have the broadest evidence base as being the most impactful carry more points, and those that are still good but perhaps less impactful or less of evidence base have smaller points. That said, out of all 63 of them, they've all been adjudicated as being impactful, but just some are more impactful than others. So to achieve a rating, you need to collect strategies that add up to, so a Fitwel 1-star rating, you'd need to achieve strategies that have scores that add up to between 90 and 104 points. To achieve a 2-star rating, it was between strategies that add up to between 105 and 124, and for a 3-star between 124 and 144 points. So 144 points is the maximum, and obviously no one's got that yet, and I very much doubt anyone ever will. But and it's worth saying that these are third-party verified strategies. So all these strategies need to have been verified by a third party who knows absolutely nothing about the project, knows nothing about the clients. They're just looking at this cold in terms of the information that's sent to them. So from that point of view, every step, every strategy that they're trying to do, they're encouraging you to achieve counts. Sorry, go on.
There's no inspection of the building as such. You're looking at strategies for managing the building.
Correct, yes. So there's no third-party verifier that's going to come around and have a look at the building and ask to have a look at the monitors or the meters or those things. They don't 100% take it on trust. You still need to demonstrate, provide information or as-built information that certain things exist, whether that's around things like smoking, signage, or indoor air quality monitors, or evidence that the building might have been constructed after a certain date, certainly in terms of the asbestos abatement requirements. So you need to, you still need to do a little bit of work to demonstrate that your compliance, but there is no third party coming to inspect the building. So often, actually, what we're often doing, we work very hard at, is ensuring that when we gather the information, working with our clients, is that we're presenting the evidence and information in a comprehensive file that allows them to easily follow through and understand all the strategies that are being put into place. And so it's probably just worth covering of just some of the things that Fitwel covers. So the evolution of Fitwel actually is, and Fitwel is actually operated by an organisation called the Centre for Active Design, who are based in New York, and they are licensed by the Centre for Diseases Control, the CDC in the US, and as well as the FDA and a couple of other US healthcare orientated organizations. And what CDC did is they've done all this research and they had all this evidence and information that related to the health and well-being, occupational studies and research and information, and they just felt that there was something that really needed to be done with it. So what they did is that they then approached the CDC, who then built this into the Fitwel that we see today. And what they're looking at is 7 key sort of health impact strategies, and each Fitwel category is linked to those. So these are impacts around community health, that they reduce morbidity and absenteeism, there's social equality for vulnerable populations, increases in physical activity, promotion of safety, healthy food options, and obviously from the mental health aspects, it instills feelings of well-being. And it's there's one key thing in here, I think, which people often forget, is that promoting occupant safety is possibly sometimes the one area that people are at greatest risk in a building is accidents, and being prepared for accidents or first aid training and things like that. So these are things that often, I think, aren't the prettiest to look at, but actually they, having strategies in these cases demonstrates what's impactful. And I kind of guess just for now, Yvonne, I mean, that's as much in terms of a sort of high level sort of explanation of what Fitwel is, and we can go back into a little bit more and a couple of other areas sort of in a short while. But I know you've got a few other questions.
Thank you. I think you set out the sort of general advantages of Fitwel and why it's grown in popularity. Are there any 1 or 2 specific strengths that you would point to that's made it so such a good standard?
So yes, and yes, and I say yes and no. I think as we are, as a consultancy, we love all health and well-being standards equally. It's like asking you to choose between my children, and I've got one son who's very good at cricket, and I've got another one who's very good at rugby, but they're both good at sport. So apologies, just moving something that's fallen over. But where I think Fitwel, that there are a couple of areas where I think that Fitwel is helps, and I often find in certain scenarios finding myself promoting it over the well-building standard. Fundamentally, I think it is keeping it simple. I really like the idea of strategies, and what strategies are obviously doing, we're targeting outcomes, and because Fitwel is aimed at encouraging people to develop and incorporate strategies, and the language they use is very much is far less. It's language and requirements that a day-to-day operator, a facilities manager, an office manager, a building manager, or a design team might understand. And what I often find working with the the project managers or the clients or the design teams, the architects that I work with, they're often looking for more complication than there actually really is. And often when I'm just starting some work on projects within the 22 Bishopsgate, which is a big tower, brand new tower building in the city of London. And the first reaction when we first started speaking to some of the new occupiers in there was, actually, it's too late. It's already been designed. You know, the actual fact they've already finished fitting out some of these. And actually, what we were able to demonstrate was that actually that didn't have any impact on what some of the measures and opportunities they had to target them. So from that point of view, keeping it, the fact that it's relatively simple and straightforward to understand and operate, I think is probably what sets it aside from most. That said, that it is in a market where it feels like that's competing against something that is more complicated, and occasionally you've got one system, perhaps for want of a better word, trying to dumb itself down, and you've got another one on the other hand that's almost sometimes trying to become a little bit more onerous in order for people to take it seriously. But I often believe that the certification systems aren't essential. They're useful, but they're not essential. They are they are often used, and certainly in case of the viral response module, it is a classic case of an organisation using these standards to communicate what it is that they've achieved. It's like a BSI British Standards kite mark. It says, look, this is what we do. These are our strategies, and someone else from thousands of miles away who's verified this independently and confirms that we're doing this. So it says something about the organisation and the space, and that is where I think these certification systems are really useful, and where I think Fitwel perhaps it has a strength is that, as I said a little earlier, is by having by setting out these strategies. We often then will sit people go, do you have a strategy? And they go, well, actually, no, we don't. They say, well, okay, look, is there one we can download? They say, and we go, no, we can build one. Let's identify what are the outcomes that we're looking to, that we need to target, what we want success to look like. Because if someone suddenly sees that there's a specific threshold in a strategy, and they're not realistically going to achieve it, the problem with tick box exercises often is that people will stop and do nothing, rather than because they don't think they're going to succeed at it. And even if you don't achieve the full compliance threshold, actually doing something is still better than nothing that you do otherwise. So and I think Fitwel is slightly closer in that mould than others.
It's interesting because you've pointed to the way that Fitwel actually makes a difference. That in a sense, it's you sitting down with a client with the standard, and then devising the strategy that's actually creating the impact in a way.
Yeah. So one of the things that we often do, and I might just share. Can I share my screen with you again and just demonstrate? And I'm going to use this example of 22 Bishopsgate, 22 Bishopsgate again. And I think I might have shown you this before. So this is what we look at when we're often doing something called a gap analysis. Is the first thing that we do, and I'm just going to come across to here, is we identify what are the base building attributes. What are the attributes that the building have that build towards improving the outcomes on various health and well-being themes to the to the tenant, to the occupier. And we also do this for the developers themselves as well. And we just identify these areas of strength. So on the screen here, what you're seeing is that we identified all the strong base build attributes in green, and then we then identified the likely strong occupier attributes in blue, and then we these are things that we were confident, we knew that they had existing strategies. And what that allowed us then to do is to identify those ones in yellow and orange as things that need a little bit more work. So right at the outset, what we're saying to people is, look, there might not be a huge mountain for you to climb. Let's shorten the list and improve our chances of achieving those. And for a building like 22 Bishopsgate, what we did, it's really helpful with tower buildings, this graphic, because it's basically a stacked, it's a stacked column. But what we were able to do is, to identify those strategies that frankly are impossible. So let's not worry about those. And as we're starting to build up the building here, what we've been able to demonstrate for people is that, frankly, almost to a degree, for them just doing nothing, actually they're already, they're in a really strong building. And we also identified that the occupier has got, there are a number of attributes that they have already designed in, that they might be already written into their company policies. Sorry. So what we're now targeting are just these top things, these strategies at the top. And this is a really useful approach to take when one's doing a gap analysis, because it allows us to, particularly for a developer, to help them orientate or prioritize those things that are impactful or important. And that may benefit their tenants or occupiers in the future. And similarly, at the same time, it allows occupiers potentially when selecting buildings, to identify those buildings that have impactful management strategies in place as well. And none of these are fads, I should add. So often someone will pick up a fad. An example of a fad would be a green wall.
Yeah.
Is that you know how much money they spent on it by how prominently it might feature in all their marketing material or something like that. And that's not to say that green walls are things of great beauty. I love them, and they're very important in contributing to one's biophilic responses and connections with nature. But there is no one single silver bullet with these things. As I mentioned before, what we're trying to do is capture as many steps as we possibly can, even if that means that you miss out on the one most impactful thing that the Fitwel has to offer. You've got all these other things that add up to something, and add up to something consequential. So, and I think this is, and this is an approach that we certainly it's within Sentinel try to promote with our clients, and that is this approach of identifying what matters first, what outcomes are important, and then comparing that against something like Fitwel or the Wellbeing standard to see how one might score. And invariably, actually, what you see is that you're starting to everyone tends to buy into the challenge in terms of across a design and delivery team. But also they're more emotionally invested in the process as well. So you're less likely to see important things value engineered out, as obviously on all projects will happen with value engineering. And I think certainly over the next couple of years, given the pandemic and the recession that we've been going and are going through, will become increasingly important.
What thing limits the buy-in to Fitwel? When do you get kind of a resistance or a sort of kickback from when you're promoting these kind of standards?
So that's really, it's a great question. So quite often it's the same. It's the same things. And when we, as you know, a couple of years ago, we undertook this landmark research for the British Council for Offices, and that was a study called Wellness Matters, Health and Wellbeing in Offices and What to Do About It. And there were 12 key findings that we promoted in those, but the four that I promote most regularly is the first is that wellness is a team sport. It's the most important thing. It requires a diverse team and an integrated and ideally early response and engagement. It doesn't necessarily mean it's all right, we'll appoint James Pack and Sentinel in and they've got us covered. Because it just doesn't work that way, because I'm an expert in bringing the teams together and helping them understand and prioritize what needs to be done and then to implement it. I'm not a mechanical engineer. I'm not an expert on ventilation or on cooling strategies or on cleaning. Certainly speaking to my wife, I'm definitely not an expert on cleaning, but there it is. So but what we're able to do is to able to manage and bring in the right sort of expertise as and when that. So that's the first thing. It's a team sport. The second is that often many people, when we're struggling for buy-in, there is this assumption is that we would really like this, but we just don't have the budget. And there's this sense that that there's a perception, at least, that it's that it's an expensive exercise. So there is a perceived cost and lack of understanding, well, perceived cost and a lack of understanding are the principal barriers to that. And the second I've already just I've already alluded to is that people are just uncertain about the usefulness of the certification itself. Is it in terms of the value for and the value for money? The other key finding, which perhaps not necessarily is a barrier to that, is just the fact that whatever the strategies that we're always implementing is that you want them to be underpinned by data that you can collect before, during, and after a project, and that data can be anything. It doesn't have to be digital. It can be the bit like you often see the 3 buttons in a loo. How clean is this? It could be coins or tokens in a jar as people come. It can be anything, but being able to measure stuff before, during, and after, I think is a really important aspect as well.
So talking about that kind of measuring and monitoring, have you seen? Have you gone back to buildings after the first Fitwel certification and seen the kind of changes that actually occur in the building management and occupation?
Yeah. So the simple answer, well, actually, I have, is because actually when I haven't been to London since March. So I'm due to come up tomorrow, actually, as it happens. But my office in ATE Cheapside was one of the first projects to get to be certified. And the one thing that and actually the project that Elementa undertook in there, they only spent £4,000 or something like that, next to nothing really, and they're already in there. They were just there was their budget and off they went. The one thing they really regretted doing was measuring everyone's happiness and what their thoughts were before they did it. Because when everyone came back in, they came back and said, this is just brilliant. God, we love this. And some of the things that they did were really easy and really simple. It's a brilliant exercise. It would be a brilliant case study in how effective these things can do, as they said, had they measured it beforehand. So there is no real empirical data that necessarily backs it up. However, that said, it's a question of what you're wanting to use it for in the process. Some do it because they like collecting badges. Here we go. Here we've done our office, and no one ever knows it. I've done some work. I won't name the client where they've it's gone straight up on their website. It's straight up on an awards entry for something, but no one in the business knew that they'd done it.
or felt that they.
Well, they would have noticed it, because sometimes I think there is it's quite hard with certain buildings because there will be an absolute placebo. I mean, I've got to be careful about talking about placebo because I'm not I'm not an academic, but there's that saying that if you're going to go into a new building, of course it's a new workplace. Apart from the fact that you liked your old space because you were facing a window and no one could see what you were doing, or you were sitting next to your friend previously and now you're not. More people love going to somewhere new because it feels lovely and new. So there will always be that bounce. But because it's backed by scientific evidence. So the research has led to us saying, but doing this will be impactful. It allows the organisation to already almost have that level of confidence that what they're doing is right. Now, there may have been, I know that there are some organisations that have tried to undertake some form of empirical measurement before and after the interventions using the Wellbeing standard, and they've tried to look at things like absenteeism sort of data. And again, the problem with this, it's very rough and very complex, because often it assumes that illness is the only reason why people don't go to work, for a start. In actual fact, absenteeism, 50% of absenteeism is down to management, as opposed to health, and it's actually 52 down to sickness, traditionally. So, so those are those things. But I think there are other ways in which it can often be measured. That is on things like business productivity. Profitability is often, is often up, often associated with newer spaces. But it's something that's yet to be, that I'm familiar with, as something that's has been empirically recorded.
Are there bits of the broader well-being agenda that you feel are not captured well by Fitwel?
No, I don't. So I have to be careful, because I don't want people to come, I don't want anyone who might watch this go, well, he clearly loves Fitwel, clearly hates the Wellbeing standard, because there are people who love the Wellbeing standard who think Fitwel is a bit slightly, it is slightly weak. And actually, one could argue the more robust criteria and compliance for a system, the better the better the system. And there's a good argument to be had for that. So I don't think that, but they're sometimes comparing slightly different. They're comparing slightly different things, and one has been very much driven from the top down, if you like, and the Fitwel, the F in Fitwel. Don't ask me what the FITEWEL actually stands for. It does stand for something. It is an acronym, but the F in that stands for facilities. So it was something that was very much intended with. Now the first version of Fitwel, and Fitwel is now up to version 2.1, whereas the Well is still moving into version 2. So there have been, and we'll probably with Fitwel be onto version 2.2 or even 3 next year. So it is a little bit more nimble, and by virtue of it being nimble, it's not covering absolutely everything that others might cover in the same amount of detail, and it does that deliberately. So I think. And so what we will start to see is everything now starting to incorporate more of the viral response requirements as standard.
I'll make sure that my students go to the website and have a look at those new viral response standards. Yeah. Just head to the future. What do you think we'll see in the future concerning health and well-being of commercial building users?
So I tell you what's been fascinating, is that, it's not just in the built environment, but everything you've heard about the pandemic has basically been how it's just accelerated everything. Yeah. And I don't think it's accelerated anything at all. It's just got, and I love the way that for what you could say accelerating, you can just say people have just now been given no choice. You've got to do it, and that's which is great. So the great irony here is that a lot of the things that you were starting to see that were coming up in the COVID secure requirements around these things, albeit slightly mercenary and drastic, you could argue, were fundamental, and now which are essentially building regs, for want of a better word, were some of the elements that Fitwel and other health and wellbeing standards were incorporating. And I think therefore there is more appetite now for people to be a little bit more adventurous, and there are more people who are prepared to listen. So health and wellbeing was sort of a board C-suite level discussion before. Yeah, of course, it's very important to us, and we really wanted to sort of do this, and then it was, and then it sort of drifted away, and they push. Now actually it's a bit more meaningful. So which is really good. So I think a lot of people are going to be taking it a lot more seriously. Now, what I hope happens in the future is that people start to look at identify where the opportunities are and the things that are impactful, and look at the ways in which they embrace and adapt and start to incorporate these requirements and strategies and standards and certification if they want to go it that way. I think it's something that is, as I said earlier, it's a team sport. So you do need a really diverse and integrated, response to it. So often, in many organisations, small teams are better. Yeah. Fewer chefs. However, in this instance, actually, sometimes to achieve the best. The most amazing things, the more diverse the team, bring in the right expertise at the right time, can bring exceptional results. And the one example that I would use of this is the Nightingale hospitals, because there is, and I know that there was a pandemic and there was a panic and everything else like that, but you look at what fundamentally, actually, when you had an integrated but extraordinarily diverse response, because out of necessity, that what is achievable in such a short amount of time. I think, of course, everyone was extremely motivated to do it, but I think it demonstrates what's happened. If our old, slightly perhaps NHS and government responses, that everything being left to committee, and it was trying to get to a smaller, then it probably would have been a bit of a disaster, or less successful, I should add. So that's what my expectation is for the near future, and I think it's, as I said, that our focus always, and the same with the Nightingale ops, is to focus on the outcomes, the things that we want to improve and change, and then allow the teams who are responsible for delivering them to innovate the solutions.
That's really, really interesting. Thank you so much indeed, James. That's been very, very helpful to the students. Thank you.
Brilliant. Thank you, Yvonne. Take care.